I'm Joanne Poje. I live in Columbus, Ohio. I work at the Center for Integrative Medicine. I had originally trained as an OBGYN in New York and had practiced traditional OBGYN for approximately 15 years, but then had decided to pursue other passions, and that included, I'm trained in acupuncture. I also work with addiction medicine and I'm board certified in that. And then got involved with the A4M approximately 3 years ago. Mainly, I was frustrated with being a traditional doctor and wanted to make people well and heal people. What's important in integrative medicine is the whole mind-body balance. Nothing really happens isolated, so that disease is sort of connected to stress, to state of mind, to things you're eating, things you're not eating, things that you should be doing or not doing. So it's all connected. And I think in traditional medicine, part of the problem I found was that I was focused on just treating very specific entities, and people really weren't getting well. And what I found refreshing with this is to be able to step back, to look at the whole person, and then to sort of figure out the puzzle to fix this, fix that, and then the whole picture kind of improves. So you're really getting people on the road to health, both preventative and with whether symptoms that come in. We're doing some genetic testing, because I think we know now there's a lot of genetic SNPs or genetic defects that some people might have that predispose them to certain types of disease. We're doing lots of nutritional testing, looking at like vitamin deficiencies, amino acid deficiencies, balances of the good fats, the bad fats. And we're looking at neurotransmitters. We're doing hormones. Hormones are really important because that needs to be in balance. And so this all sort of interconnects, and in order to treat the symptoms that people have, you really need to put everything back in balance. As opposed to simply doing a cholesterol test or doing a sugar test and then fixing that with a medication. The idea here is to treat the things that are causing the problem. So if we're wanting to treat high blood sugar, we want to find out what inflammatory processes might have driven that, what food allergens might have driven some immune dysfunction, and then get at the source of that, and then perhaps avoid having to continue the people on other traditional medications. We have sort of a team, so we have somebody that works with the nutrition that will counsel people. We work with people to find what exercise program is going to work for them, and have somebody a training person that can set up some personal training. We have a healthcare coach that keeps people on track, that will call the patients, so that people kind of keep on track and know that somebody's cares and somebody's helping them get through those things, and they're there if they have some questions. And then just education about many of the types of environmental toxins, a lot of the different exposures, different things that we're faced on a day-to-day basis that drives cancer, that drives disease, and to educate people as to what they can do to protect themselves against those things and how they can better avoid having some severe illness further on down the road.